Hello everyone, thank you for the opportunity to present the topic of whether or not our OR teams are ready to respond to an OR fire and the role of virtual reality simulation training. I have no disclosures. Sorry, I uploaded the presentation a couple of days ago and this is not the right one. I went back to the speaker room and checked it this morning. That was the version that. Yes, a little bit more easy to read. Thank you so much. So opera room fires occurs approximately about 500 times a year annually, and then results in a few preventable deaths and minor injuries as well. So at SAGES, we've created the FUSE curriculum. However, one consideration is that the educational curriculum alone may not be effective in helping learners retain critical knowledge, establish skills needed in an emergency setting. As a result, high-fidelity simulation training was then created to fill this gap and provide a safe environment for practice of skills in a highly stressful situation such as an OR fire. However, attempts at simulation with the use of actual open flames and smoke are often infeasible due to strict regulations, costs, and the complicated nature of reproducing OR fire events. So with emerging technologies such as virtual reality, we can now provide realistic OR simulation environments and allow clinicians to practice in a safe, reproducible, and fully immersive virtual environment with no risk to actual patients. We previously created a VR simulation platform using the FUSE curriculum, and eventually the group enhanced the platform by developing the first AI-based OR fire simulator, which was then validated at the 2019 SAGES Learning Center. We then brought the technology back to BIDMC with the aims of determining whether surgeons, anesthesiologists, OR nurses, and techs are ready to respond to an OR fire, and whether the FUSE curriculum alone is enough to prepare clinicians to respond to OR fires under stressful environments. Also, can a validated virtual reality simulator train OR members to safely respond to OR fires? And three, determine if artificial intelligence during VR simulation is helpful in evaluating and improving performance in real time. A total of 180 participants were asked to participate in this IRB-approved study. Let me see. The simulation trial starts with the surgery drape already on fire, and the participants are required to contain the fire by following the proper sequence. They were not informed of the correct sequence prior to the study. And in order to interact with the virtual equipment in the OR, the participants are required to walk close to the item, highlight it, and use the handheld controller to accomplish the desired task. The simulation performance was evaluated based on completion of the correct actions of sequence. Of note, the virtual simulator was designed to formally assess and response and train clinicians to safely put out an OR fire in accordance with the FUSE guidelines. Participants who did not correctly respond within the first 3 attempts were given additional attempts with AI assistance. And for the trials with AI assistance or guidance, the AI agent are programmed to predict the participant's next action and provide a virtual warning sign within the simulation to warn the participants of the potential error. The participants are still able to continue the training whether or not, or either by following or ignoring the warning signs itself, and you can see the warning sign in a little screenshot below with an X marking across the items that are highlighted. A total of 180 participants completed the simulation training, and 170 participants had completed the pre and post survey. This is the breakdown of the participants' demographics. Prior to the VR or simulation event, participants were asked about their confidence level in putting out an OR fire. And overall, about 45% were moderately or very confident in their ability to respond to an OR fire. Anesthesiologists of note were likely to respond that they were moderately or very confident. Interestingly, only 8 participants were able to respond to an OR fire on their first attempt. And in the first trial, most participants incorrectly selected the use of a fire extinguisher or removed the surgical drape as a first step. And only a minority of participants correctly turned off the anesthesia workstation or removed the face mask, which is the oxygen source. Participants underwent the first 3 attempts with a total pass rate of about 24% by the 3rd try, and an additional 54% passed by the 5th attempt with AI assistance. Of note, professional roles or training levels, prior confidence in responding to OR fires, and having read the FUSE material did not show a significant difference as potential predictors in numbers of attempts needed to pass the training. In conclusion, as SAGES, we have created important material for patient safety and developed a fantastic FUSE curriculum. So we implemented the curriculum in a simulator that was validated at SAGES the year prior and brought the simulator back to our clinical setting. We've learned that under crisis and pressure, we might not be doing as well as when we're answering a multiple choice test, and that with VR simulators, we're able to better prepare clinicians to deal with OR fires, and that AI is an innovative way to teach algorithms. Thank you very much.